Don't don't listen to the CDC. They are dead wrong about coronavirus. Absolutely dead wrong. Make sure you have your food ready. Make sure you have your supplies ready. Make sure, if you want to get some masks, get some masks. Whatever you want to do to prepare for this. It's coming. It's already broken out in the U.S. CDC has already failed to contain this. I don't know if it's incompetence or if it's corruption. It's almost their actions indicate almost that, like, it almost seems like they wanted it to break out in the U.S. It's like they weren't even trying to contain it. Look at this. 3 new confirmed or presumptive cases of the coronavirus contracted from unknown sources were reported Friday. 3 new cases. And the thing is, these are people who decided to test on their own instead of going through the CDC through testing. Because the CDC has still only tested 459 people. This was last updated January 21st. Is this a joke? 459 people? South Korea is testing thousands of people a day. I guess if you don't test people, then that means your cases will continue to remain low. And then you can continue to look good or what? I don't know what's going on. 459 cases. You gotta be kidding me. The patients from these 4 cases have no known travel history or exposure to someone who traveled or been infected. Not all 4 have been confirmed by the Center for Disease Control. I don't care. I don't care about the CDC anymore. They screwed this up big time. New cases were reported in Washington, Oregon, and California. So now we have 2 cases in California of community spread. In Washington and Oregon, again, we don't know who gave these people coronavirus. And then furthermore, all the CDC does is contact tracing. Right, so they trace all the contacts, and then they tell those people, or they check those people for a fever or a temperature, and if they don't have a temperature, they're like, all right, you're good, cool. Or they might ask them to self-isolate, maybe. Is this a joke? Do what Singapore is doing. Singapore's the only country who's gotten coronavirus that's actually been able to contain it. But no, the American Center for Disease Control, which should be a standard to the world on how to operate, is just completely screwing this up. Completely screwed this up. Look at this. 2 in California, 1 in Oregon, all the way up to Washington. That means this whole swath of the West Coast could potentially have cases all over it. Right? I don't know if someone traveled from California to Washington or if it just spread up through California into Oregon into Washington. We don't know because we're not testing for coronavirus. These people, so again, these cases were not confirmed by the CDC. Right? They were tested locally. But they tested positive locally. So the CDC isn't even testing these people. You have to get people who are operating outside of the CDC to be proactive enough to test for actual coronavirus. That woman in California earlier this week, not even last week. Earlier this week who had coronavirus, the doctors had to ask twice to get her tested for coronavirus. And the CDC refused because they said, oh no, she hasn't been to China. And this website, oh my gosh, still says, oh well, if you haven't been to China, don't worry. You don't have coronavirus. Bull. That is the biggest load of garbage I've ever heard in my life. There's like over 50 nations worldwide who now have coronavirus cases. And they're spreading throughout all these nations. And they're still saying, well, if you haven't been to Wuhan province, then you probably don't have coronavirus. Where do they get this idea from? Are they not even looking at the numbers? Do they even care? What are they doing? It's like they're living a month and a half in the past. Oh my gosh. Let me see if I can find it. CDC in action. They're doing nothing. They're doing nothing. Global locations. Let's see. Oh, wow. Okay. Look at this. They have this on their map. But they're still saying, well, if you haven't been to China, look at this. Oh, well, if you haven't been to China, don't worry. You don't have coronavirus. And we're not even going to test you if you haven't been to China, even though we're seeing cases across the entire West Coast of community spread. Look, those cases that we see, that's the tip of the iceberg. Okay? We see 4 cases. The number of cases that are probably out there, each one of those people probably indicate an additional 50 or 60 cases, and that's a modest estimate. We can have several hundred to several thousand cases on the West Coast right now, and the CDC has tested 459 people. I can't believe that these are the people who are supposed to protect us from disease. They haven't been looking at this disease. They haven't been looking at how fast it spreads. They haven't been looking at how it spreads. And then taking action accordingly. No, they're operating on a manual that was written for something like SARS. And they're still operating on that manual. Hey, it worked for SARS, so it's going to work for, SARS-2. Technically, this virus is SARS-2. COVID-19 is the disease caused by the virus. Oh, it worked for SARS-1, therefore it's going to work for SARS-2. No! This is way more contagious than SARS. But they're still operating on that manual. Outdated. Bureaucracy. I don't know what it is. Oh my gosh. Case in the U.S. Let's see how updated this is. Oh, January 21st. That's the last time they updated this. Even though in the past 3 days we've gotten 5 new cases. We'll get to updating this. I mean, don't they have someone... Can't they just have someone update this report? How hard is that? We want outdated information, right? Especially considering how fast this is moving. This is moving outdated information from January 21st. That's good. That's cool. We're okay with that. Don't even bother with the CDC website. It's worthless. Wait, where was that? Where did I see it? Travel information. China, Iran, Italy, Japan, South Korea, yeah. But what, we've banned travel from China, and they're still only testing people from China. Again, that woman who had it a few days ago, they wouldn't test her because she didn't come from China. Oh my gosh. And yet they admit there's, 4 other countries other than China with sustained transmission, 4 other countries which we should already be banning travel from. Hong Kong, whatever, I don't care. Japan, these destination experience. Okay, so they have these as warning level 3, but they're not testing people from those countries? I mean, are they... I don't care. They should be banning travel from these countries, but it's too late. It doesn't matter at this point. It's already broken out. Where was that thing? Oh, yeah. Symptoms? Maybe they finally updated it. 4 confirmed coronavirus cases. Mild symptoms, severe, and his symptoms include fever, cough, shortness of breath. I think they maybe updated it. Yesterday I checked, and it's like, if you haven't been to China... This was yesterday. If you haven't been to China, don't worry. Really? Yeah. If you develop a fever and symptoms of respiratory illness such as cough or shortness of breath within 14 days after travel from China, you should call ahead to a healthcare professional and mention your recent travel or close contact. That is completely irrelevant at this point. It's already broken out in the U.S. We need to move away from this mentality that it's going to come from China. We've isolated China. We've stopped travel from China. It's not going to come from China. The cases we have now didn't come from China. We need to stop talking about China. We need to start talking about these other countries. We need the CDC to update their advice here. How about China or Korea or Japan or Singapore or one of these other countries with sustained transmission? Yeah, South Korea. I mean, or Iran. I don't think we travel to Iran much anyways. If you have had close contact with someone showing these symptoms who had recently traveled from this area, you should call ahead to a healthcare professional and mention your close contact with their recent travel. Your healthcare, no. We need to move away from this idea that it's going to spread, that someone from China is going to come here and spread it. That's not how. It's already spreading, and it's already here, and it's spreading from people who haven't been to China. I don't know what to say at this point. Look, we could have, it's gone all the way up to Washington from California. It's spread all the way there. And the CDC is still just, testing a few cases. They need to distribute these kits nationwide, and in local governments need to start to find a way to test for coronavirus on their own without the CDC, because apparently the CDC is dragging their feet on this matter. They don't want tests to happen because they just don't want people to know how bad it is. I don't know. Okay. That's it for now. Just be ready. Thanks for watching.